Hello, my name is Ken Cutbush. I'm an orthopaedic shoulder surgeon. I want to talk to you about preparation for a joint replacement with me. A shoulder replacement is either an anatomic or a reverse total shoulder replacement. We go through a fair bit of preparation in the lead up to that shoulder replacement. The aim of all of the preparation is to eliminate any risks or as many of the risks or as much of the risks as we can from the actual surgery. And we can do quite a lot in the preparation for the shoulder replacement. So one of the big things is we get you seen by a physician preoperatively. One of the physicians that comes to the hospital where I do the shoulder replacement surgery. So there is a physician here that knows you and has gone through your medical history and has looked to see if there's anything that we can identify that needs to be picked up before surgery. We don't like surprises on the table when you're under the anaesthetic, and we really need to get rid of or avoid any of those issues and pick them up preoperatively and deal with them preoperatively. You'd be surprised how many people come out for a joint replacement surgery who otherwise feel they're well, have some issue that needs to be addressed preoperatively to give them the best possible preparation for that surgery and for the anaesthetic. So that's very important. It's clearly been shown to reduce complications and to be cost effective for patients being seen by a physician preoperatively. In that lead up for the physician, we get you blood tests. So we want to check your full blood, your ELFTs, CRP, ESR, we check your vitamin D. For diabetic, we check your diabetic control for starters. We'll need a list of your medications for the physician and a list of all your past medical history. So that can come from your GP. Now, other specific things we do for the shoulder, of course, we need scans for a shoulder replacement. We will need a CT scan so we can plan the actual shoulder replacement surgery and make sure the prosthesis is available for us, the right prosthesis for you, and also that the prosthesis, when we put it in, is positioned in the best possible place to give you the best possible result post-operatively, particularly in terms of range of motion. And usually that will mean that we do planning and we have a patient-specific guide created for you, or we have navigation prepared for you when we are in theatre doing the surgery. Now, a couple of other things there in terms of infection. In the shoulders, we worry particularly about a bacteria called Propionic bacterium acne. It doesn't really affect the hips and knees, it affects specifically the shoulders. And there are research papers out there reporting rates of P. acnes infections and joint replacements between 10 and 20%. Now, obviously, they're probably a little bit inflated, but the actual problem isn't quite that bad. But certainly P. acnes is a bacteria that lives on all of us. Propionic bacterium acnes is now called Cutibacterium acnes. It lives in our skin pores and it can get into the surgery at the time of the operation. It's a funny little organism. It doesn't cause a pus like a golden staph infection. What it does is it produces propionic acid, and that's intensely irritating. And so patients tend to get chronic long-term pain, which is really quite distressing for them. And often the only way to deal with it is to pull the whole prosthesis out, treat you with antibiotics, and then put a new one in. That's a big deal. Now, it's actually quite effective to deal with by giving you acne cream preoperative or acne gel pre-op. So benzoyl peroxide. Benzoyl peroxide is not an antibiotic. It's a topical preparation that clears the skin pores. Cutibacterium acne lives in the pores of the skin, down in the sweat glands. And so we can prep the skin. We prep it with what we call alcoholic chlorhexidine, and that will kill everything on the skin and sterilize it, or give us a sterile surgical field at the time of surgery. But within about 20 minutes or so, some of the sweat can come up onto the skin. And if the bacteria, the propionic bacteria acnes or Cutibacterium acnes is in those skin pores, it will come up at the same time and can get into the operation site. So what we do is give you the benzoyl peroxide. You do it for 2 days before the surgery, 5 preparations. So it's morning and night. So you start 2 days before. So a total of 5 preparations, including the morning of surgery. And you just put it, the main area is actually over the top of the skin, but you also put it on the armpit. It can be quite irritating in the axilla, so if it is, just stop putting it on there. And you put it on and you wash it off about 15, 20 minutes later. If you're getting a reaction to it, wash it off a bit earlier. Wash it off at 10 minutes. It doesn't need to be there for the full 20 minutes. 10 minutes will be quite fine, and you'll get less of a reaction the shorter the time the benzoyl peroxides on the skin. That will clear the P. acnes out of the hair follicles, and that's been shown to do that. There are studies out there showing a dramatic decrease in the amount of P. acnes on the skin if you use benzoyl peroxide in preparation for the actual theatre. So we ask all patients for any operation to actually use the benzoyl peroxide, but it's particularly important for a joint replacement. P. acnes tends to affect patients that have prosthesis put in. It gets onto the prosthesis and then forms what we call a biofilm, and it's very difficult once it's formed a biofilm to actually get rid of with just giving you antibiotics, which is why the whole thing needs to come out, throw it away, and then put a new one in that doesn't have the P. acnes biofilm on it. That's if you get an infection. So that's P. acnes, and that's the benzoyl peroxide. You just get it from the chemist shop. You don't need a script for it. It's just acne cream, and my office will give you the details of what to get and how to apply it. Now, the other thing we ask you to do is you use mupirocin ointment for your nose. So that is an antibiotic. It's an antibiotic cream, and you put it in each nostril, and we ask you to do that morning and night for 5 days before the operation. Now, the mupirocin ointment is for a different bacteria. It's for golden staph, Staphylococcus aureus, and that is the organism that causes those pulmonary infections where the pus comes out. And it turns out that maybe 80, maybe 90% of all those golden staph infections that patients get after an operation come from the patient's nose. It turns out that most of us are carriers of golden staph in our nostrils, and at any one time about 30% of us have golden staph in our nose. It can also be in our axilla and our groin, and it's interesting, if we clear it out of our nose, it turns out that will actually have a body-wide effect, systemic effect, and clear it out of other parts of our body as well. So it does clear this golden staph out of our systems by using the mupirocin ointment. It's quite interesting, and there's a lot of research showing that not just infections, golden staph infections for joint replacements, other wound infections, and also patients having dialysis, if they get a septicemia from a golden staph, it is usually related to one from their nose. And that we know, we're not just saying that what the basis of that statement is the golden staph has been cultured from the nose and genetically tested and found to be identical to the golden staph that's been cultured from the wound infection or from the blood infection. So that's why we use the mupirocin ointment, and it's very effective for that. So that's an overview of preparation for a joint replacement, either an anatomic or reverse total shoulder replacement. There's a bit involved, it does take a bit to do, but it is very important to do. Well, what we want to do is see no complications out from an operation or a joint replacement, and certainly we need to minimize them as much as possible, and it's that attention to detail that's so important. Thank you for listening.